The focus on equity to sustain global programs on HIV is absolutely paramount. Equity is important because equity goes to the root of trying to ensure everyone is treated fair, and in the context of HIV, everyone is able to receive services, whether you're young, whether you're in a rural area, whether you're a sex worker, whether you're a drug user, whether you're a mother who's pregnant.
If we leave any population to be marginalized, then that means that we're not even fulfilling our purpose of equity. So it's really important that equity becomes an agenda, and we walk through the journey of equity by ensuring that all the stakeholders, all the groups, all the communities are part and parcel of all the conversations that happen.
And I also believe in the fact that the people living with HIV are actually the ones with the experience to tell the researcher, the scientist, frontline provider, the lawmaker, the policy maker, that look here, this strategy works, this does not work. This intervention works, this does not work. Why? They are the ones with the lived experience of what it means to stay on lifelong treatment. They are the ones with the experience on what it means to seek a prevention intervention, use it.
I personally believe that communities have to be at the center of that sustainability agenda, and also ensuring that human rights, human dignity, the right to access healthcare without stigma, without discrimination, should be part of that.
Looking at laws like in Uganda, the Anti-Homosexuality Act, this really takes us back, pushing communities into hiding or being afraid to access services. And it's not only happening in Uganda. We've seen countries like Ghana that have also passed legislation.
Stigma and discrimination affects the populations disproportionately. The experiences I would go through as a woman are quite different from the experiences of the man. Or the experiences of the adolescent girl and young woman are quite different from the experiences of the adolescent boy and young man.
Integration of HIV services within the whole health sector or system is important. But I think it's also, we need to acknowledge that there will be some services, especially for key population. Let's talk about transgender women. Let's talk about men who have sex with men. But I think what we could also recognize in terms of mainstreaming, we could do ensuring that the communities who continuously remain marginalized or criminalized have dedicated health facilities that are actually providing all the services within one point.
And this is a question about choice. Will I choose to expose myself in a space where I'm not wanted, where I'm looked at as a crime, where I'm still stigmatized? Or will I keep away from accessing healthcare to protect myself? It means if we will integrate HIV in the healthcare system, we risk losing those populations to healthcare. We risk people not coming for services because they are scared of your life.
The integration and the push to integrate HIV services to the broader health system is something that is good and something that is important, because it will allow the broader health service to benefit from the gains that have been created through the consistent funding of the HIV response, through the training of human resources for doctors, nurses, through the infrastructure that has been built. However, before we integrate, it is important for us to assess and see how well are the systems prepared in terms of human resources, in terms of infrastructure, and in terms of financing.
So for us to really sustain this, we need to see how we can bring more medicines closer to people, and also for the agencies that produce these medicines to really make them more cheaper and affordable. But we cannot also downplay the fact that for countries, especially countries, Africa, and also low middle income countries, that we pay in meeting the different debts. So we cannot sustain medicines because you want to be able to choose, what can I prioritize, what can I not?
This is an important time for funders to step up, to be able to sustainably fund programs on human rights, programs on gender, programs that remove structural barriers, and programs that challenge punitive laws and policies that we continue to see increasingly being enacted in Uganda, in Ghana, and threats in Malawi and Kenya.
So if those programs have not been strengthened, we cannot talk about ending AIDS by 2030, and therefore it would mean we still have to keep the momentum going.